Hello, my name is Allison Warner and I'm the Chief Editor of Orthodontic Products. Welcome back to In the Sterilization Room with Jackie, where we talk with infection control and prevention expert Jackie Dorst about what you need to know as you navigate this new world with COVID-19. For over 20 years, Jackie has been a consultant specializing in instrument sterilization and infection control and prevention in the dental setting. She holds degrees in microbiology and dental hygiene and has been a featured speaker at the American Dental Association and the American Association of Orthodontists. Jackie, glad to be back with you.
Hi, Allison. We continue to introduce new subjects with our In the Sterilization Room, and I enjoy looking at the comments that are posted on the Orthodontic Products website, your online, and on the YouTube, because these are available on YouTube also. So we get some good comments and a lot of thumbs up.
Yeah, exactly. And it's interesting that we've been, this is our 10th episode. And so it's fascinating to see that, we're 10 weeks into this and there is still so much to talk about and new stuff every week. So,
yes.
Well, on that note, let's talk about the fact that a lot of states are reporting increased coronavirus infection rates. They're on the uptick right now. How does that affect orthodontic practices, many of which have now been open for over a month?
Yes, Allison. Unfortunately, over half of the states in the United States are seeing a moderate to an extreme increase in cases. I happen to live in Florida, and Florida is one of those states that's seeing now over 2,000 new coronavirus infections per day, higher than even at the beginning of closure and at the first stages of the pandemic. Texas is right up there at the top, Arizona. So there's several states with much higher numbers. And for the orthodontic practice, that's going to mean that it's more likely that a patient could come in that maybe has been exposed to socially or at home or in their work environment. And there's also the possibility that a team member might get exposed, maybe not in the orthodontic practice, but when they go to the grocery store or they go celebrate a family function. Get together for a birthday party, or to celebrate those delayed graduations that we've all heard about. So there is going to be that increased risk. And I think what the best recommendation that I can give to orthodontic practices today is don't let your guard down. Keep all of those good checklists and practices going that you put in during the first few days that you were reopening your practice. Continue to take patient temperatures, continue to take employee temperatures, and do the scanning for symptoms on them. And then your due diligence with your PPE and with disinfecting surfaces and hand sanitizing, using those ABHRs. Fortunately, we're seeing an increase in supplies, so more supplies are available, but we just can't drop our guard. And I think that's what happened. I even saw an interesting story this today on the media with the CNN that they had reported that 16 friends went to a bar, young adults, to celebrate a birthday. And they didn't wear masks, and they made a celebration out of it. And within 24 hours, they were all infected. So much so that the city closed the bars and required a complete sanitizing. And I think those establishments were closed for a week. So it made me think of the young orthodontic team members that we have, because we're human beings, are social. We're anxious to get back together. We've missed celebrating those special occasions like a work anniversary where someone's been with us for 10 years, or a birthday party, or all of the other life events that we enjoy celebrating together. So we have to look, for both our patients when they come in and the procedures we're doing with them, but we've got to maintain those systems that have proved effective on lowering the infection rate and preventing the rapid spread. We're going to see, as we reopen and we get more contact with each other, we're going to see an increased number of cases. And so I think we just need to re-emphasize to the team, don't get lax.
Right.
Keep
and that
those protocols in place, yes.
And that extends to outside the office as well.
Yes, yes. And, I'm getting some calls on
Hmm.
that from orthodontic offices. The doctors, I've had a couple of calls, one just yesterday, and
Uh-huh.
said, well, we've had an employee who was
Mm.
exposed to somebody that had COVID-19.
Hmm.
Now, and I didn't know, what the circumstances were.
Right.
Was it a family member? Were they there for 2 or 3 hours?
Hmm.
Or was it that they went to another facility and maybe they were there for just 10 minutes and they wore masks the whole time? Then that's going to be a minimal risk of exposure. But the office was concerned, do we have to send this person home for 14 days to
Mm.
self quarantine? They
Right.
wanted guidance. They wanted to know what's the most recent guidance
Hmm.
for that particular employee incident. And they'd
Hmm.
already looked on the CDC website, and it was sort of overwhelming, all of the information that they
Yeah.
came
Yes.
across.
Yeah.
It was just, there's so much when you're trying to look, well, this is what our specific situation is, but none of these particulars, the apply to us in this particular situation. Yeah.
Hmm.
So I would encourage the team to have their plan together and to make certain that they do have the most recent guidance. And
Yeah.
the ADA toolkit that we've referred to in a lot of our sterilization room episodes with it, it's been updated 3 times.
Okay.
So if they have the old ADA toolkit, then they
Hmm.
definitely need to download the one from May 29th. That's
Okay.
the most recent.
Okay.
And so when you do that, this is a new document that is in that ADA toolkit, and it tells you exactly what to do if a patient reports with a COVID-19 exposure after
Hmm.
treatment.
Mm.
Now, remember the ADA toolkit recommends that 2 days after the patient has been into the orthodontic practice, that we give them a telephone call.
Mm.
Maybe send them a text message. And
Yeah.
I would title that a care call. You were in our office on Wednesday,
Mhm.
and we want to know how's everything, how are your braces or your newer aligners, was it a good visit, do you have any issues or concerns that we need to help you with, and have you had any COVID-19 symptoms since then? Because
Right.
they may have been in that window of pre-infection, if you will,
Mhm.
that 2 to 3 days before they have a fever,
Yeah.
and then on Thursday, after their appointment, they have a fever and
Mm.
it's 102 and they're
Yeah.
miserable,
Mhm.
and they may not have to go to the hospital. It may not be but they know that they are infected with something. Well, then you're going to need to go, the orthodontic practice is going to need to go back to the team members who cared for that patient,
Mhm.
and monitor those team members, and take the appropriate precautions with it. So this new document has 2 categories. It makes it real easy. I love one-page sheets, that are not so complicated.
Yes.
And there is, and you can see, look, it looks like a little dashboard with
Right.
there, where it's a high risk and a low risk. So
Mhm.
that high risk would be with a patient who was diagnosed with a COVID-19 infection. They came down the next day with a high fever, and it gives you 4 bullet points of what
Mm.
to do, for monitoring the employees and then notifying patients with it. The low risk is probably what we're more frequently going to see. And it really says in there that the employee does not have to quarantine for 14 days and stay at
Mhm.
home, but we do
Right.
need to take note of the date.
Mhm.
Ask the employee, what procedures did you do? Was it an aerosol generating procedure with it? How long do you think you were with the patient? Was it just 5 minutes to deliver an aligner, which
Right.
would be very low risk? Or
Okay.
was it a 15-minute to 30-minute appointment to rebond a bracket?
Okay.
So maybe a little more aerosols, a longer exposure, and so there would be a little bit of an increased risk with it. So there really is a triage that needs to
Mhm.
take effect. But if you're not calling employees, I mean, excuse me,
Yeah.
calling patients
Right.
after the office may not be aware that they did have an exposure incident. So that would be an exposure in the office, but there's also those social exposures, and
Right.
you know, we can't, the orthodontic practice, we can't all live in a bubble.
Right.
You know, we can't just come to work and go home. We
Yeah.
still have to have other family members contact, maybe visit
Mhm.
parents or grandparents, or go out socially. Churches are reopening now, so the social distancing, wearing a mask, hand sanitizing is still the best protection. But there are going to be employees that are exposed, and I'm even getting questions now from orthodontic practices that about, well, I've got an employee who wants to take a trip.
Ah, so what are you telling them?
And, you know, yeah, what is this? Should I have, after that employee takes the trip, are they going to have to quarantine for 14 days afterwards?
Mhm.
Well, again, it's going to be unique. The circumstances are going to be unique for each employee. And
Mhm.
I had one doctor call me. She's located in Florida, and she had one employee who wanted to go to North Carolina, and it was a driving trip.
Okay.
And then she had another employee who wanted to get on an airplane and fly to Puerto Rico.
Mm.
So you see how the potential social exposure could be a little bit different for
Right.
those two. Now,
Yeah.
at the time that we discussed this, almost 10 days ago, North Carolina was plateaued out with infections. Now that the infection rate is coming up and increasing, there's a
Mhm.
little bit greater risk with it.
Mhm.
To get on an airplane and be on an airplane for an hour, 2 hours, 3 hours,
Yeah.
increases your risk of contact. And then the numbers were still increasing for Puerto Rico.
Mhm.
So you can advise the employee, can you delay your trip?
Right.
You know, ask, is there a way, because this could be a risk. But
Mhm.
obviously the orthodontic practice can't dictate that.
Right.
But now you employees really should check with the health department and the local community about the infectivity in that area.
Mm.
Um, you know, there are certain cities that are really considering now having to re-implement closure and more precautions with it because of that higher infectivity.
Mhm.
So it is going to be a case by case
Right.
recommendation, looking at the guidance. Yeah.
What is the responsibility of the practice to notify patients if a staff member has tested positive or if they're exhibiting a lot of the symptoms but haven't yet gotten tested?
Well, you have to again look at it case by case.
Mm-hmm.
If a staff member tests positive, obviously you know they're infected,
Yeah.
and all of the patients that were seen by that staff member at the time that they tested, the test was taken and they tested positive, would need to be notified
Mm-hmm.
so that they would be aware that they had been exposed. Now, the orthodontic practice may have a team member that shows definite signs or symptoms, is running that fever, you know, has a 102-degree fever, the cough, has lost their sense of taste or smell. I mean, that's a
Right.
very strong indicator with it, but they're not sick enough that they even go to the doctor and they
Right.
never get tested.
Mm-hmm.
They're going to self-quarantine themselves for that 14 days. So
Right.
it may wind up being 10 days that they're away from the practice. And from the time that the very first symptoms are identified,
Mm-hmm.
they would need to notify all patients seen by that staff member if it's an orthodontic assistant
Okay.
that is providing direct patient care.
Okay.
Then they would need to notify. We've had a team member that was identified as most likely COVID-19 infected.
Mm-hmm.
Please know that, you know, we practiced all personal protective precautions, all disinfection. Your risk is minimal, but we do want to notify you that you've had an incident of a potential exposure with it.
Mm-hmm.
And so then it would be the patient's responsibility. And that's, you know, there's some areas that are doing very good contact tracing,
Yeah.
you know, for a patient that does or come identified as infected and go back. Well, was this exposure at the orthodontic office,
Mm-hmm.
or was it when you went out to a restaurant?
Yeah.
You know, identifying what could be the connection and how was the infection transmitted.
Right.
from it. So it is going to vary greatly by individual case. And I think that's why it's so important for us to continue to keep those records of doing the patient temperature testing, the employee temperature, because you can definitely identify the day that it started. And
Right.
then for the employee, one other thing that we need to talk about is, okay, you've had this employee who is infected. When is it safe for them to come back to work?
True. Yeah.
And the CDC gives us very specific guidance on that. If there isn't any testing done
Mm-hmm.
and they just had symptoms, but they go, yeah, it was probably a COVID-19, then
Mm-hmm.
they should wait 3 days since their recovery. And that means no fever, without any fever reducing medicines, and
Okay.
no symptoms.
Okay.
And so 3 days, no fever, no symptoms,
Mm-hmm.
without fever reducing medicine, and 10 days since their first symptom. So
Okay.
if they lost their sense of smell and taste, then 10
Mhm.
days from that, and that they have no fever and no other symptoms, then it's safe for them to come back to work.
Okay.
That would be symptom-based strategy. If
Mm-hmm.
you're going to do a test-based strategy on it, then no fever, again, without taking Tylenol, aspirin,
Right.
no fever reducing medicines, no symptoms, and then 2 negative tests done,
Right.
taken 24 hours apart.
Mm.
So then they would be safe for them to come back to work. They would be non-infectious at that time.
Okay.
So it's the circumstances for each exposure are going to determine what are the precautions that need to be taken. Is it
Mm-hmm.
self-quarantine? Do we need to do that?
Yeah.
And what is the risk? And there's so much information out there,
Yeah.
and you want the office to make their decision wants to have the latest information. So that's why
Right.
I said download the ADA toolkit that is
Mm-hmm.
from May 29th.
Okay.
And it's going to have this summary page that I've already showed you, plus one more.
Hmm.
And it actually is the what to do if a staff member tests positive.
Okay.
Okay, and it gives them simple one-page guidance again, and the questions to ask that employee. What was the date of your last contact that with someone that could possibly have been infected? How long were you with that person? Was it more than that 15 minutes? Because
Right.
you really need to be around the person for long enough to breathe any of the respiratory particles, the aerosols from that person.
Okay.
And then what was the approximate distance?
Mm.
Obviously, the 16 people that we were talking about, they weren't practicing social distancing.
Right.
And that's where, they were probably laughing and talking and lots of aerosols out. And
Right.
then, of course, are you experiencing any symptoms? So you do a triage just as you do with patients when they're coming in for their orthodontic appointment.
Yeah. Well, I feel like we should also mention that excuse me, we've talked a lot about how this affects staff, but this also applies to the doctors as well.
Yes, because the doctors can acquire an infection, from any of their other contacts. And oh my gosh, if the doctor's not there, we can't see patients.
Right. Yeah.
So, it really can impact the orthodontic practice.
Yeah.
So, as healthcare workers, I think we have an obligation to practice all of the precautions and
Yeah.
be as safe as we can. From having been a dental hygienist for over 40 years, I
Hmm.
know that years ago, we'd come to work sick. You might have a cold or something, and you go, okay, I'll put a mask on, but I've
Right.
got all this full schedule of patients, and we felt committed to the patients and committed to the practice, and you
Yeah.
you didn't want to not come and see patients, and of course,
Hmm.
risk losing income if you didn't have
Yeah.
sick days or have coverage for it.
Hmm.
And then with CDC, as 2003, they published their new infection prevention standards and their guidance. And then 2016, it's always been stay at home from work if you're sick. That's, as far
Hmm.
as cover your cough and sneeze, wash your hands, and stay at home from work. Yet we
Hmm.
haven't always done that.
Right.
Now, with this airborne disease, aerosol transmission, high infectivity of the SARS-CoV virus, then I think staying at home when we are sick is becoming a new standard of employment.
Yeah.
that it's much more a part of our work practices now than it has ever been in the past.
Yeah.
And I don't see that going away. I think as the term new normal, this is going to become one of the protocols of the new normal, as
Right.
is, wearing N95 mask or the level 3 mask with a full face shield during
Mhm.
all aerosol generating procedures.
Right.
So, and this virus is still with us. It has not gone away.
Yeah.
So the next 2 to 3 months, we're going to
Mhm.
have to see what's the peak, and it's going to be regional
Yeah.
with different, depending on population centers and infectivity. Again, with me living in Florida,
Mhm.
we have Disney here and,
Right.
Universal Studios. And it's when you go on vacation, you want to go have dinner out. And I think you're in communities like that, you're going to see a higher infectivity rate.
Yeah.
So we will have to continue our social distancing and using our precautions.
Yeah. And well, staying on top of your local news and your state's, status, definitely.
Yes, yes. And that's the nice thing about the ADA toolkit. And again, I want to emphasize, please download and make certain that you have the May 29th
Right.
issue of that, because there are hyperlinks embedded throughout the document that if you do want to go and see what is the CDC guidance for a healthcare worker who is infected, then you can just click on that hyperlink and it takes you directly to the CDC guidance, because the CDC website is tremendously large and you can spend hours searching for the guidance that you want. And then
Right.
when it gets to OSHA guidance and what's safe for employees, then it
Mhm.
will also has that hyperlink embedded in there. Um, Even looking at your disinfectants. We talked last week about the disinfectant wipe shortage. Well,
Yeah.
if you're having to look at a new brand of disinfectant because your brand is not available, it's
Mhm.
embedded in the ADA toolkit that
Yeah.
you can go the hyperlink to the EPA disinfectant list for hospital level disinfectants and verify the new brand. So it is a very valuable resource for orthodontic practices.
Definitely. Well, is there anything else, switching gears a little bit, is there anything
Well,
else that came out in the
yes,
last week?
there is. As we've talked about infections and looking at infections from employees and from patients with it, and those N95 respirators.
Mhm.
During the PPE shortage, the big question has been, can we sanitize this? Can we
Right.
reuse
Yeah.
N95 respirators? And as I've mentioned in the past, the FDA and NIOSH have not given an approval for an in-office decontamination method for the N95 respirators. However, there is an approved, and I say approved by the Food and Drug Administration, by NIOSH,
Yeah.
decontamination provided by a company named Battelle.
Okay.
And Battelle has a number of facilities throughout the nation where they have these very large vaporized hydrogen peroxide units that have been tested and validated that they will decontaminate an N95 respirator.
Mm.
And through government assistance with it, that decontamination is now available to dental and orthodontic practices at no charge.
Oh, okay. Great.
So the orthodontic practice could go to the Battelle website.
Mhm.
And if we can put the link up, then that'll give them the information to go to. And you'll
Mhm.
need to register their orthodontic practice for it. And you will get a registration number
Yeah.
and then the method for shipping them back. It takes
Mhm.
about a week turnaround time.
Okay.
I've talked with a couple of offices who have gone through this, and
Mhm.
there are 3 pages in that are very specific instructions for what
Mhm.
type of mask that the practice can send back to Battelle for
Okay.
decontaminating.
Okay.
Now, the first condition is that it has to be in good condition.
Okay.
The straps still have to be attached to it. And if it's deteriorating,
Mhm.
then obviously you can't reprocess it.
Okay.
The different brands of masks can be reprocessed anywhere from 2 to maybe 5 times
Oh, okay.
by this decontamination. It depends on the brand and the type of material that it's manufactured. One
Okay.
of the very strict requirements for decontamination, though, Allison, is for the orthodontic team to realize, and since many of us are female, women
Right.
on the team, is that the mask, the N95 respirator mask, must be clean to be reprocessed. That
Okay.
means it cannot have any face lotion, no sunscreen,
Oh.
no lip gloss, no lipstick, nothing that could rub off on the inside of the mask.
Ah.
So if Battelle receives these masks and they're soiled on the inside, then they'll
Uh-huh.
throw them away.
Oh.
So it's real
Right.
important for the team members. And when I read that, I go, oh, I don't know if I could comply with this, because sunscreen is the first thing in the morning, and lotion.
Yeah.
So having a naked face to be able to wear these
And a lip
masks,
gloss,
uh,
even like
yeah, no chapstick, no moisturizer, because any oils or that can get on the inside of the mask will hinder or prevent decontamination. So that's
wow.
one of Battelle's requirements. And
Right.
then you'll have to, the office will have to write, and there, again, there's specific instructions on the Battelle website, very detailed instructions that you can download, print out, and you've got to identify them by the team member's name. So if Jackie Dorst sent her mask in, I'm going to get Jackie Dorst's mask back. It's
Okay.
not that it's decontaminated and you could use anybody's mask.
Yeah.
And then once you've labeled it with the proper labeling, then you're going to have to put it in a brown paper bag or some sort of paper bag, not a plastic bag.
Okay.
And then you could seal it and
Mhm.
ship it and put all of these again in a box and send them to Battelle. And
Okay.
Battelle will decontaminate those with the vaporized hydrogen peroxide,
Mhm.
repackage them, and then send them back. Now,
Oh.
the identification process has been very good from
Mhm.
what I've learned from a couple of offices,
Mhm.
but that big stipulation of the mask must be clean, no body oils, lotions on the inside, I think is going to be a challenge for orthodontic offices shipping them in. But
Yeah.
we know what a crisis these N95 masks have been and how very expensive they've
Yeah.
become for the practices. So having a free service that will decontaminate them is an added bonus. And I'd like to also add follow up on the N95 mask that stockpiles have been released to
Oh.
either the dental association
Mhm.
in different states or to the health department, depending on what their distribution is. So some of the doctors, the orthodontist, you may receive letters even from 2 or 3 from maybe a FEMA or the health department in your area saying,
Mhm.
we have some N95 respirators. We understand that the dental profession is is available, considered critical care for
Right.
those N95 respirators, and you can make your request for a distribution of some of those.
No, that's great to hear.
Yeah.
Definitely. Well, I think this is really good information. Covered a lot, but I think this is great information for our viewers and keeping them aware of what they need to keep track of. So thank you, Jackie.
Thank you, Allison, and thank Orthodontic Products for providing this opportunity with a video to communicate the latest information from the sterilization room.
Definitely. Well, thank you. Okay, we will be back next week with the next episode of In the Sterilization Room with Jackie. In the meantime, be sure to keep up on the latest orthodontic industry news or check out past episodes of In the Sterilization Room at orthodonticproductsonline.com. Until next time, take care and stay safe.